Are daycares really hurting our children? This question has sparked intense debate among parents, educators, and child development experts. In this thought-provoking video, we delve into the pros and cons of daycare and explore the potential long-term effects on a child's emotional, social, and cognitive development, from the impact of early childhood education to the role of caregivers in shaping young minds. We examine the research and expert opinions to separate fact from fiction. Join us as we explore the complex issue of daycare and its implications for our children's future. Whether you're a parent, teacher, or simply concerned citizen, this video is a must-watch for anyone who cares about the well-being of our youngest generation. I'm Dr. Tanisha Burke, your positive parenting coach, and welcome to our channel. Are you a subscriber? If you're not, we encourage you to subscribe. And when you subscribe, you are joining a growing positive parenting community from around the world. Also, by subscribing, you help this video get into the algorithm so that other parents who are interested in similar content can join this channel. Since the 1970s, there has been a steadily growing demand for childcare services in many industrialized countries, due in part to the increases in the number of women employed outside the home and the proportion of single-parent families with young children. With the growing demand, parents often face the difficult decision of whether to place their children in daycare. While daycare provides essential support for working families, research spanning over 4 decades has highlighted some potential negative effects on children's development. So, for the remainder of this video, we'll explore these effects in details, discuss the types of daycare and the factors influencing outcomes, and offer practical advice for parents to mitigate these effects when their child is at home with them. A quick disclaimer. Before we get into the details of the topic, I want to highlight to you that the information in the remainder of this video is from peer-reviewed scientific publications from studies conducted in the US, Canada, the UK, Scandinavian countries, Germany, and Australia. To begin, let's look at the type of daycare services that are available. Childcare arrangements can broadly be categorized into 3 types. The first type of childcare is home-based care by relatives or non-relatives. This care is provided in the child's home or another individual's home. The second type of care is center-based care, which are organized facilities that provide care to multiple children in a group setting. The third type of care is the regulated home-based care, which is care offered by licensed providers in their homes. Each type of daycare varies in structure, quality, and the developmental impacts it may have on children. Understanding these differences is essential for parents to make informed decisions. So now that you have an understanding of the different type of daycare services that are available, we're now going to switch gears and we're going to look at the factors that influence the effects of daycare. The first factor that influences the impact of daycare is quantity of time in non-parental care. Research indicates that the amount of time children spend in daycare significantly affects their behavior. Extensive exposure to daycare, especially center-based care, during the first 4.5 years of life is associated with higher levels of externalizing behaviors such as aggression, disobedience, and impulsivity. Children who spend large amounts of time in group care are more likely to experience behavior problems, including hyperactivity and adjustment issues at school entry. The second factor that influences the effects of daycare is the type of care. For many parents, deciding the type of care can be challenging, so let's look into the advantages and disadvantages of each type of care. As it relates to center-based care, the positives include improved language skills and memory performance. The negatives include higher rates of teacher-reported externalizing problems such as aggression and disruptiveness, particularly when children start attending before age 2. Regarding home-based care, the positives include less physical aggression in regulated settings. However, the negatives include greater physical aggression and hyperactivity when care is unstable or children are exposed to multiple arrangements, which includes they might be going to different caregivers instead of having one consistent caregiver over time. The quality of daycare is the most significant predictor of children's outcomes, and now we're going to look at what that entails. The benefits of high quality care is that it encourages pro-social behavior, cognitive stimulation, and emotional regulation. It is protective for children from disadvantaged backgrounds or families with maternal depression. When daycare services are of low quality, there's increased stress, which is evidenced by elevated cortisol level, poor peer interactions, and greater behavior problems. Age of entry is a factor. Children entering daycare before age 1 are at a higher risk of developing social and emotional challenges. Early exposure to large peer groups may negatively affect toddlers and younger children, but can be beneficial during the preschool years. The last factor we cover today is group size. Larger daycare groups often result in less individual attention from caregivers, which leads to decreased social competence and heightened stress in younger children. Smaller, more intimate settings foster better emotional and behavioral outcomes. So, we have gone through the factors that influence the quality of daycare services. Now we're going to switch gears and look at some of the potential negative effects of daycare. The first negative effect of daycare is behavioral issues. Increased aggression, non-compliance, and impulsivity have been linked to higher quantities of non-parental care, especially in center-based settings. Peer pressure in large groups can lead to bold but challenging behaviors that strain relationships with caregivers and teachers. The second negative effect of daycare is related to emotional stress. Low quality care correlates with elevated cortisol levels in children, indicating higher stress levels. The stability of care arrangements play a crucial role in reducing emotional stress and promoting secure attachments. The third negative effect relates to social challenges. Less social competence and increased behavior problems are common among children exposed to low quality or unstable daycare environments. Early and prolonged exposure to large peer groups can hinder the development of strong interpersonal skills. And as it relates to long-term effects, extensive time in daycare during early childhood has been linked to greater impulsivity and risk-taking behaviors during adolescence. Behavioral challenges at school entry, such as hyperactivity and difficulty adjusting, can have lasting effects on academic and social success. While daycare may be a necessity for many parents, you can take the proactive steps to mitigate its potential negative effects and foster your child's development at home. So I know you've heard all the negative effects of daycare, but guess what? There is hope because there are things you can do to mitigate those effects, and we're going to cover them right now. So I encourage you to get a pen and paper so you can make some notes on our suggestions. Our first recommendation is to choose high quality care. Look for daycare centers or home-based care which have low child to adult ratios, small group sizes, and caregivers who are trained in early childhood development. Before you sign any contract in allowing your children to be at a daycare, it's important to visit the facility to observe interactions between caregivers and children. Look for warmth, sensitivity, and developmental stimulation. Our second recommendation is to limit early and extensive exposure. So if possible, delay the start of daycare until after age 1 or preferably age 2. Limit the number of hours your child spends in daycare, especially during infancy and toddlerhood. So the 7-8 hours in daycare is definitely not healthy for children. The shorter time they are in there, the better it is for them. And I know parents, it's difficult for many who have to work. But we have some other tips. If you can't help but have your child in a daycare facility for that long, we have other tips that can help to mitigate the effects of that. So your child is in daycare for 7-8 hours, which is a need because you have to work. One way to mitigate against that is to create a nurturing home environment. So it's important to prioritize quality time with your child outside of daycare, engage in activities that promote connection, such as reading together, playing, or simply talking about their day. Practice positive discipline by setting clear boundaries with empathy and respect. This helps your child feel secure and understood. And if you need more tips on positive discipline, you can search our channel on many different topics that can give you pointers on what you can do as a parent to be firm and kind at the same time. Our next recommendation is to focus on emotional regulation. Help your child navigate their emotions by modeling calm and constructive responses to stress. Use tools like daily reflection prompts or mindfulness exercises to strengthen their emotional awareness. If you are struggling with regulating your emotions or maintaining mindfulness, we recommend that you get our parenting journal because the prompts in there helps you to reflect on how you respond to your children, what's working for you, what's not, and most importantly, you get to see your pattern of interaction over time. And with that awareness, you're in a better position to change your behavior patterns that are not good regarding your parenting relationship with your children. Our next recommendation is to foster social skills. Encourage play dates with smaller groups of peers to balance the social dynamic they encounter in daycare. Teach conflict resolution and empathy by discussing emotions and perspectives during daily interactions. Our sixth recommendation is to build a strong parent-child bond. Even if your child attends daycare, the quality of your interactions at home has the strongest and most consistent influence on their development. Show affection and provide consistent support to reinforce their sense of security and belonging. Our seventh and final recommendation is to consider staying home for the first few years, preferably the first 3 years. So if you are financially able, consider having one parent stay home with your child for the first 3 years of life. This critical period lays the foundation for emotional security and cognitive development, which offers your child the benefits of consistent, loving care in their early years. Daycare, when chosen carefully, can be a supportive resource for families. However, it's crucial to be aware of the potential negative effects and to take deliberate steps to address them. By prioritizing high-quality care, limiting exposure during the early years, and fostering a nurturing home environment, parents can ensure their child thrive both in and outside of daycare settings. Remember, your presence and attention as a parent are irreplaceable in shaping your child's emotional and behavioral well-being. We're now at the end of our video and we discussed a very controversial topic. Especially in most recent years, many parents have been discussing and debating whether or not daycare is a good thing. Now, I know for many families, both parents need to work, or you might be a single parent family, and so staying at home is not an option. We went through the negatives of daycare, things that impacts the quality of daycare, so I hope you paid close attention to those. If you have no choice, you still can mitigate the risk by limiting the number of hours. If you can't do that, there are things you can do as a family to remain connected so that you communicate to your child that they are in a safe space with you when they get home. And once they have that security and sense of connectedness, it really helps to mitigate the effects of daycare. Now, if you benefit from this conversation, please leave your comment in the comment section. What was daycare like with your children? If you're currently in daycare with your children, what is it like? Are they in a center-based or home-based daycare? Are you experiencing any challenges? We would love to know. If you have friends and family who you think may also benefit from this content, please share it with them. Thank you so much for joining us, and goodbye for now.